Hello. So I looked over your case, your SOAP note for the patient that you put in, and I came up with two differential diagnoses. The first one was tonsillitis, which is inflammation of the tonsils, which it can present a sore throat and a fever, and you have swollen lymph nodes. It's most common between the ages of 5 and 18. Tonsillitis can be either viral or bacterial. So most of the time, the provider will look in your mouth, it'll look at your throat and neck, checking for redness, white spots, swollen lymph nodes, to determine how they would treat the tonsillitis. Most of the time, you just need adequate rest, like Tylenol and sometimes non-steroid drugs to help treat the tonsillitis. The second one, I didn't think it was a tonsillitis. I thought it sounded more like a mono to me. That a differential diagnosis is usually in patients between 10 to 30 years old, usually younger, high school age, such as your patient, which can prevent sore throat, fever, and swollen lymph nodes too. There's really no treatment for this because it's a virus. You just have to adequate hydration, analgesics, if you have a fever, treat the fever, and an adequate rest. If the person plays sports, they shouldn't play sports for at least 4 weeks. To completely confirm mono, there's an antibody test called the monospot to check for antibodies of Epstein-Barr virus. And there's no antibiotics to treat the virus. I thought that the patient had mono more than the tonsillitis. So those were my two differential diagnoses.